A new study finding that the health of children in the United States has declined significantly over the past 17 years. In fact, scientists determined that American children were 1.8 times more likely to die than children in other high-income countries between the years of 2007 and 2022. Here to react is Fox News senior medical analyst, Dr. Mark Siegel. Dr. Siegel, thank you for coming in.
Great to see you.
Great to see you, too. Obesity up 4%, and children are more likely to have chronic conditions. That's up 15 to 21%.
And some of those chronic conditions are mental health related issues that we've been talking about, stemming from loneliness, anxiety, attention deficit disorder. We are over-medicating our kids. They are poorly nourished, and they're not having enough activity. This report from the Journal of the American Medical Association, which was quite extensive, from UCLA and from the Children's Hospital of Philadelphia, concluded that. It's the same thing that Maha's been saying. We've got to get at what we're feeding our kids, why we're not giving them more activity when they're very young, and the issue of what we're medicating them with. On top of that, there are other issues of why 1.8 times more deaths here in our young children.
Yeah,
there's crib deaths, there's congenital heart disease, there's the mental health issues I talked about. There's also more accidents that are involved in car accidents, homicides, firearm related, all of that higher in this country than in other countries. All has to be addressed.
Okay, I know a lot of diabetics and obese people are eating low-carb ice creams, keto-friendly protein snacks, and sugar-free sodas, but they contain this sugar substitute that, according to this study, can carry unexpected health risks. What is this substance that we're finding in those sugar-free drinks and things like that?
And by the way, this is tied to topic one also, because our kids are very obese, they have asthma, and they're having very unhealthy type of substitutes. It's called erythritol. It's in stevia, it's in Splenda, it's in Truvia, it's in Whole Earth. The reason it's used is because it tastes like sugar does, with about 80% of the sweetness of sugar, but it doesn't do anything to your glucose or to your insulin, but it does do something to your body. That's the problem with this. And they found an increased risk of stroke and heart attack previously on people who use this regularly. And the new study out of Colorado, Ainsley, shows that it affects brain cells. It literally affects brain cells and takes away the stuff, nitric oxide, that makes brain cells flexible, what we need, and makes them more constricted, which increases the risk of stroke. I think it's a warning that we have to do things more naturally.
The senior author of this study gives a warning about consuming this sugar substitute. Given the epidemiological study that inspired our work and now our cellular findings, we believe it would be prudent for people to monitor their consumption of non-nutrient sweeteners such as this one. So they're saying those who consume multiple servings a day are impacted the most, and it could result in a heart attack or a stroke.
We have to get our sweetness naturally, and I don't mean going back to added sugar. The way the president said, I mean, I like cane sugar better, but I think it's definitely healthier. But I think overall we need more fruits and vegetables, and we have to not addict our children to these artificial sweeteners in the first place. They're unhealthy. This study, very, very important.
Dr. Siegel, thank you so much.
Great to see you.
Great to see you.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.